Welcome to Why Medics Matter, a podcast for doctors by doctors, brought to you by Doctors Training. I'm your host, Dr. Simon Fraser, and I have a real privilege as somebody who has had a huge impact on my career. She knows I talk fondly about the value of coaching and mentoring. So Susy is going to come talk all about coaching and mentoring. But before we do that, Susy, could you just tell us a bit about how many hats you're wearing? What are your different titles?
Thanks. Yeah, pleasure. Happy to do that, Simon. It's really nice to see you. So one of my roles is as an associate dean in the region that we both are based in, Yorkshire and the Humber. So that's in what used to be known as deaneries. I think we're still calling them deaneries. I also have a role as the coaching lead there. I was previously the training program director for public health, which is my background. So I did that for about a decade. And in my associate dean role, I have oversight of the Future Leaders Programme. So look at leadership training and development, what our offer is, and if that's fit for purpose. And also do some work with the professional support unit. And then I'm also a coach and a coaching supervisor and a facilitator, and I teach coaching skills, and also some other sort of leadership and development workshops around communication, imposter syndrome, action learning, that kind of thing. And then more recently, I've become interested in storytelling and have set up a not-for-profit around storytelling in the NHS, staff storytelling, not patient narratives, which is really exciting. And I'm also involved with some colleagues in the area of shame in medical education. So how does it impact us? What can we do about it? How can we develop shame competence so it doesn't get in the way? So that's your starter pack of roles.
I might get into that new stuff a bit later on. But I want to go back to the coaching because I think your scheme's probably over 10 years old now, and I was probably about cohort 5. What first sparkled your idea to set up a coaching scheme for doctors?
Well, probably a few things. One is you're right, it is over a decade ago. So I trained as a coach myself, and I thought it was really a useful skill set. And I was also struck by the contrast between our roles and the sort of professional heft, the weight of responsibility that we carry, and then other similarly weighty professional roles. I don't know, maybe in finance, for instance, where coaching was a norm, a professional added value tool that was offered. So there was kind of me becoming aware personally and finding it helpful. There was also me in one of my deanery roles where I sat on panels. So if you sit on any of the panels, you'll probably know this yourself, that are to do with progress. You come across what derails people's progress, and often it's just life. It's the fact that we're inviting our younger colleagues to do these quite challenging, punishing training schemes with professional boundaries in the form of exams, at the same time as expecting them to well, not expecting them, but they just do, don't they, have a life, which involves maybe trying to have a relationship, trying to have a child, have an elderly relative or a sick relative or a new caring responsibility or a new personal diagnosis for some of them. And those, just other stuff of life. And I felt like we were shortchanging people because we were waiting until crises occurred in training before we were offering anything that was remediable. So that was one aspect where I thought, well, coaching could have a part to play here, although there's an interesting discussion that we might have about where's the boundary between coaching and therapy and OC health and all of that kind of stable of things. And then there was perhaps another factor, which was that I could see medical training is really, really excellent at teaching us to follow guidelines, to appraise evidence, to think about best pathways and algorithms and stuff. But it denudes us really of independent thinking often, and when you think about what derails you later on in your career, it's not, have I practiced best practice or can I follow this algorithm? It's, why don't people in my department like each other? Or how can I navigate that really tricky relationship? Or what are we going to do about this critical budget situation when there's such a level of discord across the unit. These are really kind of thorny problems, but they're the bread and butter of healthcare leadership. And so I was thinking that that was another space where coaching could really offer something, where we could encourage people to think for themselves. So I'm not suggesting for a minute that we don't need algorithms and pathways and evidence and best practice. Of course we do. But that's largely in the domain of our clinical practice, isn't it? And that's the bit that people come out with excellent training after however long their training program scheme is. But the other bit, the bit that enables them to be a really effective colleague and hold a responsibility and a leadership portfolio, is the bit where I think practice at independent thinking is really valuable. So I guess at the start, I was seeing coaching as a space that could offer those kind of space to explore that kind of stuff.
And you touched on a few things there: coaching, counselling, therapy, and the other one sometimes is mentoring. Because these words that mean they're instinctive what they mean to you and I, but maybe somebody listening, can you help us unpick these different?
Absolutely.
What is coaching? What's mentoring? What's therapy?
Let's clear that one up, because that one often comes up. Well, coaching and mentoring, I guess, are the two that are most often paired together. And in some senses, I mean, people spend hours writing books, articles on this sort of stuff. And it's interesting and it's important. But to a large extent, I think coaching and mentoring are basically both doing versions of the same thing, which is having a helpful conversation. If you want to be academic about it, the way that I explain it is that in coaching, we have an absolute belief that there's an equal relationship there. So in other words, there's nothing about your coach that's suggesting I need to mend you. I'm not offering you a solution. I'm sitting alongside you as you find a solution. And my skills are in the questions that draw out your own wisdom and expertise. So that's an equality. In mentoring, there's a kind of expectation that you've invited someone who's, in quotes, older and wiser. I mean, someone who's trodden the path before you. There may be neither of those things, of course, but to offer something in which case you've got that kind of implicit hierarchy, so they're adding in their lived experience by invitation, which then creates a different sort of dynamic. So mentors would certainly use coaching skills. They would be inquiring, what is the way that I can be helpful to you? Back in the day, I don't think that is how it happened, by the way. I think there was an awful lot of, casting pearls among swine, and the implication being you're really lucky if you get to sit at my knee and hear what I've got to say. Whereas I think a lot of what we're doing now is trying to get rid of those sort of older forms of patronage and say, can you think for yourself? Let's help you. And if you can't, where might you find availability of information and helpful knowledge that will ease your decision making? So that's coaching and mentoring. And of course, if you're in this world, you'll know that there's all sorts of, there's peer coaching, peer mentoring, near peer support. So there's a range of other things that are allied to that. But basically, think of it as a helpful conversation where you're alongside someone. You're not really doing things to them. You're just being with them as they navigate life's challenges. Then we can get into coaching versus counselling and therapy. And I think that's much more of an important interface that all coaches are clear about. And in fact, a key principle of coaching is that people would have, you'll know this, an ethical framework, and they seek out CPD and supervision. And that's because, with every coaching interaction, there's the possibility that something new arises that needs attention or hasn't been attended to before and needs thinking. And I would say as a coach and a supervisor, I come across stuff all the time that I haven't dealt with before that I need to be critical of. Critical in my thinking of. I can't just lazily just assume that I'm doing it right. I need to inquire. So the interface between coaching and counselling therapy is about asking the question, is someone in a hole and needs to climb out of it? In other words, is there an active wound there, something that needs attention and perhaps something therapeutic to really attend to that in order to resource someone? or are they ready to climb the mountain? That's kind of the way that we would frame it in coaching. So coaching, we assume that someone is resourceful. They've got all that they need within themselves. They just maybe can't see the wood for the trees. And our job is going to be to draw that out of them and help them come up with a kind of path forward. Whereas in counselling or therapy, we absolutely know that if you or I were going for counselling or therapy, we'd be seeking out someone who had an expertise that we wanted to avail ourselves of. So we're readily saying, yeah, help me out here. I need what you've got. And that's going to help me get to a place where I can then move forward. Now, there's an interesting debate in the coaching world about can you have them simultaneously, or do you need to do one first or the other? And I think that I've seen both occur well. So more often than not, if someone is in need of counselling or therapy, say, for instance, they turned up at coaching and they were distressed, and this sometimes happens because all of us can get distressed in life, but we ask ourselves, is the distress persistent and is it significant? So if it's both of those things, like maybe they can't stop crying about something, then we would have a different conversation. We'd be saying, might this not be the most helpful thing for you right now? Is there something else that you need? Can I help signpost that? Or how are you going to find that? And help someone navigate that. If they've arrived in that place and we judge counselling or therapy with them, with conversation, it's a co-produced thing to be more appropriate, then they would go off and do that first. But the door would be open. We would say, please do return when you want. Now, sometimes what I've seen is that people can come across things in life that are really challenging, but also want a separate space to park whatever that is in the counselling and therapy box, and then attend to their portfolio or their job interview or their training. And that sort of mental boxing of things can be helpful for some people, but I guess it would just be a case-by-case situation, and that would be a conversation that a coach would have. But all coaches need to be able to navigate that interface and inquire. We don't have to guess. It's not like we've got the answer. It's our coachee or our client who's going to be able to tell us. So we need to be able to open that door and sort of say, how are you feeling? And the last thing I would say on this is, and I often say this when I'm teaching, is that coaching is sometimes the acceptable front door to counselling and mentoring, counselling and therapy, much as we would like to know that we've dismantled all that stigma for mental health issues. We know we haven't, and it's really tremendously difficult for people to ask for help still. And so we need to be alive to the fact that that might be what they're asking for. And our knowledge and understanding of that landscape could be a helpful piece of the jigsaw for them to sort of explore it.
So as a coach, what I'm hearing is we need to be really tuned in if coaching's the right intervention for this person. Is this person in the right state to be able to access the skills of coaching resourcefulness, and be really mindful, like you said, this might be the acceptable route in, and actually the coaching conversation is, where else do you need access support? Is that your GP? Is that practitioner health? Is it other sort of psychology support that you can access for the PSU?
Absolutely. And I would say you need to be able to hold all of that lightly. I think, there's a tendency for us to come in as clinicians and say, oh, well, it's going to be my job to diagnose you. Well, it's not.
Diagnose and fix you.
Yeah.
And fix.
Yeah. Yeah. Oh, lucky you, I'm here. I can tell you what you need. That's not what this is about. This is an inquiry together. So I'm sensing that, this isn't very comfortable for you, or it looks to me as if you're finding this a difficult conversation. I wonder if you want to say more about that, and I wonder if you've considered what the options are right now, that kind of thing. So hold it lightly and be prepared to explore with your client or coachee.
And I'm just going to pick up on the diagnose and the fixing, because one of the things, I came on your course, I was extremely lucky to do the ILM5 qualification with your colleagues who run it, 6-day qualification in the deanery, which was, I'll say it again later, it was life-changing for me. But what I stole, I'm going to be honest, I stole something from that workshop, which I used time and time again, which is listening. And And doctors are terrible. I do this exercise so many times. I chuckle to myself when we do it, because we get people to do pairs exercise, and we talk about how to listen and the different levels of listening, and we get enough conversation. And I often say to people, how hard was that to not fix? I think doctors, and particularly doctors and supervisors, and you go into that hierarchical traditional mentoring model, we are perceived as fixers. How do we get away from that?
Yeah, well, that's such a good point, Simon, and that is the beginning of most people's learning journey. So the first thing is just to notice how hard it is. The second thing is self-compassion, is to not give yourself a hard time. I mean, we've been trained for years as professional fixers, so it's not that we want to take that away from our skill set. It's that we want to be live to the idea that maybe there's something else that we could add in. And I mean, a lot of doctors, in my experience, don't like not being good at things. It's really hard, isn't it, to be a learner again? And so we've got all of that discomfort as well to work with in the room. But I think that kind of observation of how loud your own internal narrative was about, oh, you should do this. Why haven't you done this? Do you want to try this? Other people have done that. You know, sometimes we call it advice by stealth. So there's a golden rule, isn't there, that you'll know in coaching, which is never give advice. And sometimes there are other forms of advice that creep in, like sneaking in a kind of story about someone else in the hopes that, you know, that'll be the magic thing that will make the difference. Or I wonder if you've seen this TED talk or book, article, LinkedIn, whatever. So helping people just become aware and tuned into that is the first stage. And then the other thing that I think I've found really helpful in this journey, because it's hard for all of us. I mean, I definitely have made massive gaffes along the way, is Nancy Klein's work. And if people haven't come across her books, I would highly recommend them. They're really easy reads and great to dip into. You don't have to consume the whole thing at once because of the way she writes. So time to think, more time to think. And then she's also got one called The Promise, which is exploring the whole concept of interruption and non-interruption. So Nancy, interestingly, doesn't talk about listening as a thing on its own. It's bundled up with this idea of generative attention. So she calls it listening with fascination, this idea that we're really paying attention to someone else and where their brilliant mind is going. So it's not that we're paying attention to them so that we can reassure ourselves that clever us, we guessed what they were going to say. It's that we can really give them supportive attention through, well, in this case, it's usually, looking at them. I mean, in some cultures, that's not appropriate. In some neurodiversities, as we're discovering, that's not appropriate. But essentially being with someone, being human with someone, so that they know we've got their back. And we're really deeply fascinated in what their brilliant mind is going to think and come up with next. Because that's the only thing that matters in the room, not whether we think we've second guessed. Sometimes people have said in the past at the start of coaching training, oh, I'm really looking forward to this training. I already know I'm a great coach because people always come to me for advice.
That's a red flag.
It 100% is a red flag, yes. So thinking that because you offer advice is not the criteria for being a coach. So, but we can laugh about that and explore that. And then a lot of this is deconstruction, isn't it? It's taking away these ideas that we're fixing on advice, that we're fixing, we're mending, we're solving, we're soothing, and getting into a different sort of domain where it's
feeling responsible for people where we're not.
Yeah, exactly. Taking away that. Yeah.
I'm going to make, for people who haven't heard of Nancy Klein, I'm going to make it real with an example, and that's me. So I was, as a coach, you've got to maintain CPD, you've got to maintain supervision, and you put on an amazing day for us, as you often do. And we had a workshop on time to think coaching, and I was paired with Tony Browning. Look at Tony.
I do remember.
And Tony and I had a half an hour conversation, had a coaching conversation where we were trained to the next level of coaching, which was really some fascination. Don't be thinking about I've got to ask a smart question in a minute. I've got to say something really wise. which often can keep your brain really busy as a coach, even if you're listening. And we did this exercise, and I had a limiting assumption at the time. And my limiting assumption was the thing I wanted to achieve was a sense of ease. So I know Nancy Klein talks about ease, and I wanted an ease. And I was at a point where I was running really hard, developing doctor's training as a side hustle, working 11, 12 sessions as a pediatrician. And I had a limiting assumption is that I couldn't reduce one down. I couldn't go part-time because one of my core feelings was security. Financial security for me was so important that taking a risk and reducing my 12 sessions would make us vulnerable at home because doctor's training was unreliable, not consistent. And Tony did this half an hour conversation where we started the usual way, and he probably said about 4 words and that full 30 minutes. At the end of this, I talked myself into why that limited assumption was untrue. And ended that 30-minute coaching session where I chose to go part-time. And that was, 30 minutes. And people think, oh my gosh, you need extensive sessions. That was just such a powerful, and I did one with a colleague where we were literally said we couldn't see anything. And somebody I'd never met before online told me so much about her personal circumstances at home. And I felt so uncomfortable not saying something. And I asked at the end, I said, I felt really guilty that I wasn't empathetic. And she went, my God, you were. And it's that word you mentioned, generative attention. So I just want to go back to the scheme a bit, because I've told you this before. One, it actually changed my career and my life. I came at a time where I'd been working 15 sessions and multiple hats, and I did some coaching, and I helped me work out what I love doing and giving me that direction. And I was one of a cohort of many cohorts. Why do train? So the coaching offer, just for people not listening, what is the coaching offer at the moment in Yorkshire and Humber? How do you access it? Who accesses it? And then I might spend a bit of time thinking about what the benefits afterwards.
Okay. So our coaching offer is available to any resident in the region, Yorkshire and Humber region. And when I say resident, I'm also talking about F3s or people who are taking some sort of gap, because we recognise that transitions are particularly important times for making good decisions and for thinking for yourself. Yeah, we're recognizing it's a workforce intervention. It's for protecting, nurturing, valuing our workforce. That's what we want to do. So people can apply through our website. There's a portal with full instructions about how to get on and access up to 6 sessions with a trained coach. And all our coaches are clinician educators. So they all have that kind of awareness of what some of the constraints are. Obviously, we don't all know what each other's career pathways have included, but we do understand what it means to work with the GMC on your horizon, what it means to be revalidated or to have annual appraisals, and to need to collect that sort of data, but also feel the pressure of wanting to do it well. And we understand as well that really hard to define thing about the weight of responsibility when you're dealing with people's health and well-being, whether that's at an individual level or a population level. That can sit really uncomfortably at different times. So what people tell us about the value of the scheme is that the clinician coach aspect of it is a particular USP. That's what people really, really welcome. The fact that they feel seen and heard. I mean, this is touching on the benefits of it, I suppose now, but they feel seen and heard because there's that depth of understanding and empathy. Now, in terms of, there's an interesting dynamic in this, which is that we encourage people to seek out a coach who's not in their own kind of host specialty. And that's because this isn't mentoring. That's because they're not going to tell you what to do, and it doesn't really matter what they've done. But what matters is that you can think clearly for yourself with the support of someone else who, of course, will, ask questions and challenge and give you thinking prompts should you need them. But they're kind of objectivity, their independence is going to be an interesting factor in that. Now, that's not rigid. Sometimes people do want someone within their own scheme for very good reasons, their own host specialty. But that's a good principle, sort of rule of thumb to think about. So, people can apply for 6 sessions, and that's also can be repeated at a different time in their training, because we recognize that people's training includes lots of different chapters of life. So, if someone needs a bit of time to think about how they're going to fit everything in when they return from mat leave, then, maybe in due course, they'll be applying for a consultant job or considering subspecialty training. Those things are equally weighty and also deserving of time to think. So they could return for subsequent sessions. But what we don't do is we don't press go on a relationship and say, well, there you go, that's your coach for in perpetuity. This is a closed, focused, time-bound relationship. And that's because we don't want to develop dependence. We want to promote independence, and we don't want to infantilize. This isn't about saying you need this from us. This is about you seeking out what you do need. And another thing to say is that people really do need to want it. So you can't be referred to coaching. You have to step up for it yourself. So it's really important that people take action and hold that kind of agency themselves. This isn't a thing that you get sent to. We'll send you back if you do.
I remember that being taught that really, really clearly on day 1 of the course by Matt, and saying, this is not performance coaching. This is not about people being sent to coach, and people have to seek it. It can help them when they're in difficulty, but it shouldn't be a targeted intervention, like if somebody's on it and poor outcome. What reasons, from your experience of seeing a lot of people accessing this scheme, what are the reasons what are the points that people knock on the door and say, can I have some coaching?
Lots of different things. And I would say there's no right reason to come. So people often bring that anxiety. Am I doing it right? Am I coming for the right reason? Am I okay? Am I valid? I mean, what I hear in all of that is the need that all of us have to be reassured that we're okay. And that, of course, comes up in coaching. So sort of common things would be some sort of change in one's life. So that might be a good asked for change, a desired change, like having a baby. It might, or choosing particular specialty path. It might be a really unwelcome change, like a new health diagnosis, or a health diagnosis since a loved one or a child dependent, whatever. It could be all sorts of challenges at home that have come to the fore. And interestingly, coaching is always a holistic space, because we have this false dichotomy, don't we, between work and life, this notion of some sort of work-life balance, which it's probably another whole conversation, isn't it? But for people to be present at work, things have to be okay in life. I mean, any parent will tell you this if they've ever had a poorly child. It's really difficult to focus at work if you're worried about how your kid is that day, and you could replace kid with any number of adult concerns that people bring. And so we say, you don't have to talk about that stuff if you don't want to, but it's welcome in the coaching session. In that sense, we see you as a whole person with all of this stuff. So any kind of issues that are popping up in those realms would be welcome. And the goal is that this is allowing people or enabling people to perform as well as they can in their workplace. So loosely, it's anything that's kind of looking like it might disrupt that. So that can be decisions around training, subspecialty training, career, location, whether to go part-time, whether to pick up a portfolio career, whether to augment with some sort of niche offer. I mean, there's as many things as there are people, and all of them are welcome. And I would say if some of your listeners are in our region and thinking about this, then if you go on the website, we've got some animations, we've got some details about what do people come for. One thing just to bear in mind is I'm framing this as if using the word challenges quite a lot. We don't tend to think of it as about rescuing people from problems. What we do think about is how can we enable and facilitate people to reach their best. So it could be a really exciting thing that's on your plate. Like maybe there's too much going on and you get to decide what to say no to, like you've had this dilemma in your lifetime. So I wouldn't frame it as good or bad, or there being problems or issues. This is more like, what's occupying your mind? What are you kind of returning to in that kind of mental loop that we all do when we're a bit stuck? And what might you benefit from? I sometimes describe to coaches, it's like tipping your head out on the table and rifling around. And it can be really surprising what you pull out of that kind of big ball of string. Sometimes you have to talk about all sorts of stuff that you weren't expecting. And that brings clarity. It enables you to get beyond that.
And nobody trying to fix it for you.
Yeah.
And the words that are sort of jumping in my head as you speak are at times of challenge, but also times of stretch. Because I've certainly met a lot of your leadership fellows who are people who are interested in portfolio careers or want to know where to take their career. They are, like you said, they're in a really good place. And if I was in industry, if I was in corporate world, I'd probably have a mentor, a coach to help me. And as you know, I've got a business mentor who I've worked with for 3 years, and so that's a different type of relationship. It's not been time bound; it's longer. But Gary, who I work with, he's my accountability partner. So if I, like you said, unpack all the stuff that's in my head and put it on the table, and have a bit of space to make some decisions, it's like, when we catch in 8 weeks, have you followed through, or what are the barriers to following through? So is there any particular stories, any standout moments from the scheme or from an experience that feels like this is why it's all worth it?
Loads. I mean, the challenge is how to answer that briefly. And in fact, I wonder if a useful thing might be to link the list of anonymized quotes that came out. We did a rapid evaluation last year, and those are just like really beautiful vignettes. People have been very honest about how coaching enabled them to find a way forward or keep going or make a positive choice or a change. Stay in medicine, absolutely. But I mean, I suppose just this week, okay, so I've got 2 things in my inbox this week. One is someone who was really struggling in foundation and couldn't complete their foundation training, had a pause, access some coaching, and I got a lovely email this week to say they are back in training and thriving, and decided to continue when that was really up in the air and completely uncertain. And then the other one is a person who was at the kind of departure lounge and training, and you will have probably seen this in your pediatric training career. Sometimes people do really well until the end, and then it just can't get through that final hurdle. And this wasn't in pediatrics, but a different specialty. Someone really, really could not get their exit exams, and for very challenging reasons. Some stuff had occurred in their life that was really, really difficult to manage at the same time as trying to do all of this. And the email I got this week was that they passed their exams and they've got a consultant post in their chosen location. So both of those are like really uplifting. I love hearing stories about that, like that. But those are wins for those individuals, but they're also wins for the system and for patients. Those are people who've decided to actively stay, enjoy what they're doing, love their jobs, want to continue. That's good for the teams. It's good for them. It's good for our whole healthcare system. And I think that's really important that we keep, our eyes on that prize, that it's a big deal. How we value our staff, how we support and engage and enable our staff to keep going is really, really important. That's a really pressing question right now in health and social care, isn't it? That we're all kind of scratching our heads about. So I just think coaching has a lot to offer in answering that.
No, I totally agree. And I think we talked a lot about residents and people in transitions between posts. And I've certainly remember getting permission by yourself to coach people who are out of training who've now got a SAS post. We probably got a good intervention in this area, but I worry about the senior doctors because I think they're even less like they've got less access to coaching, support coaching cultures. If you were to, someone might, and we get this, people say, I want to set up a training a coaching scheme or whatever. I want to do a 1 or 2 days coaching. That's great. It gives you what I call coaching for small C. Coaching small C's. I've got some better skills at listening, but if I wanted to be in a region or a trust, I really want to set up a well-functioning coaching scheme that doesn't just train a few people, but actually delivers and grows and get to where you are. What advice would you give?
Yeah, well, there's quite a lot in that. I would say
that's probably another podcast episode. Episode 2.
Very happy to return. I would just say on the senior doctor's point, I didn't mention that we also offer coaching to senior educators and also our deanery staff, because let's not forget them. They're keeping the wheels on the bus and absolutely enabling those CCTs to keep flowing towards the end point. So really, really important part of this jigsaw puzzle. And then SAS doctors, because historically they've been very underserved. So there's more to discuss there if we want to go into what the eligibility criteria are, but they're all on the website. But in terms of setting up a program, I would say really important, think about the USP and clinician coaching. Because if you make a scheme with clinician coaches, you've got something which is valued by the coachees and you've got something which is deeply valued. That's the other thing that came out of the evaluation, deeply valued by the coaches themselves. No one says this was a waste of my time. Everyone says this has helped in incredible ways that I didn't know about. So my education role, yes, coaching, but also my colleagues, also my team, also families, also much more thorny issues in sort of back at base and leadership. So important to think about the sort of frame of what you want to deliver. And I would suggest that that's a pertinent one to consider, this idea of them being clinicians. Another thing which is often overlooked, and I can't tell you how many times I've seen underspend chucked at coaching courses or any kind of courses just as a desperate measure, and then there's nothing. That is a complete waste of resource, because if you don't have any admin resource to support the whole thing and make it happen and join people up or have a platform or something, you've got to think about, matching or whether how you're going to help people join together and find each other. And there are various ways to do that. But you have to have some basic admin. And where our scheme has struggled over the years has been when that admin's resource has gone or changed or whatever. It's not been prioritized. And since we've had a robust admin support in place, it's been incredibly efficient and so much stronger as a scheme, so it can deliver more. So I'd say don't fall for the trap of the false economy of, we've got a tiny bit of money, should we just do some coaching skills or get some qualifications? Think long term. Where's it landing? Where's it going to end up? What's the goal here? And if the goal is to have a scheme, then think about the scaffolding for that scheme so that it can continue. And then I would also say, as part of that scaffolding, there has to be CPD and supervision. It's my own personal view that all doctors should have some form of supervision throughout their lives anyway, but we don't, of course, unless we're in psychiatry. So that's a gap to my mind. And I think that we'd see a lot less leadership problems and a lot less sick leave and a lot less drama if we had sort of smaller ways of supporting each other and finding safe spaces to kind of come up with solutions to the really tough stuff that happens in leadership roles, if we had that. But for coaches, it's a minimum. You have to have supervision and you have to have CPD. And that can be offered in groups and, relatively economically. It's not a big cost for what it's delivering. Everyone learns in those spaces. So I would be 100% encouraging of anyone wanting to set anything up, and I'm always happy to be contacted to talk about this, but I would add the caution that it's not just a drop in the ocean, it's a scheme. Think about longevity here and think about what the end goal is and who you're serving. what is it that they want and need. And then I would also say, don't forget evaluation. So ours started as a pilot. And luckily for us, 2 people in the very first evaluation said, I was going to leave medicine and now I'm going to stay. So it was clear that that tiny initial financial outlay, it was exceeded in benefit by the savings of keeping somebody
Return of investment.
Yeah. And the return on investment is what we've seen in subsequent evaluations. So if you want to go down the kind of metric line, it's very difficult to evaluate coaching because the outcomes, as you'll know, might be hidden and might be much further down the line. But what you are looking for is simple things like, have people got through exams quicker? Have they avoided additional training time? And for those who were going to leave, have they chosen to stay? And that's a large, a shockingly large group that talk about that. And one of the things that I find really inspiring and interesting is that people often will say that they want to go. This is my experience as a coach. Other people may have different experiences, but people say they want to leave, but coaching gives them a space to return to some reference examples that are personally valuable and important in why they tether themselves to a healthcare career in the first place. And once they can locate those and know that those examples are still there, they're still relevant, they're still pertinent to what they're doing, that maybe it's more about attending to self and adjusting circumstances in the immediate term, that they've invested hugely to get to where they are, and that is worth preserving, then you're no longer having a discussion about get me out of here. Where is the grass greener? You're having a discussion about the grass is greener where you water it. Like, do you want to water it here? Is this the work you want to do? And how can we help you stay if that's true? I mean, I'm not in the market of making people stay if they don't want to.
No,
but
it's giving them the tools to make an informed choice and not being told. As you know, you supervise me on several times, and it's so easy to get sucked in. And I want to share. I want to be very open and share. As one of my key learnings was, it's easy for coaches to be paternalistic, particularly the younger doctors, and think I need to look after them. And you give me such a, and I think if I was to take one thing away, is we need to stop infantilizing very bright young adults and give people the tools to be self-reliant, self-motivated decision making.
Yeah, I think that's true. I think part of that is language, isn't it? Thank goodness we've got rid of trainee as a word and we can call people residents. But I think it's much deeper than that. It's about seeing them as future colleagues, but starting that journey now, welcoming them in. I mean, certainly in the School of Public Health, we never called them trainees because a lot of public health occurs in local authority, and that just means, are you 16? And if you come off a YTS scheme, not helpful at all. But it was much more about professional respect, and if you really want to grow your next generation of educators, then educate them all together, help each other understand where the hiccups are, learn together. And this is where the shame stuff comes into. There's a whole load of stuff we could talk about there, Simon, about how people see each other. How do they see each other in learning environments and in practical working environments? And is there sufficient dignity and respect and compassion? And I would flag here the work of Michael West and compassionate leadership as something that is just a really essential thread through all of this, and something for all of us to kind of uphold.
You have definitely talked yourself into a second episode.
Very happy to.
No, because I think I could carry on for the next 45 minutes. We are coming towards the end of our time naturally. Firstly, I want to say a massive thank you. But before I finish and final words, I have a question to ask everybody. And if you've had a sneak clue with previous podcasts, you know what's coming, which is, if you could take all your wisdom and experience you've got now, and you could have a chat with your 23-year-old self yourself, and you just qualified as a young doctor, what advice would you give yourself?
That's a great question. I mean, it wouldn't be a short chat being me. I would say I would say, but I'll try and limit it. I would say to any 3-year-old me, I'd definitely say go and work abroad, which is what I did, which was life changing and so helpful in ways that I just, could be another episode all on its own. So definitely that, and I think what that was speaking to was listening to self, like just not, I happened to get some advice at that time which said, don't go away. That's professionally irresponsible. You'll never work again in the NHS. And I just decided not to pay attention to it. And I'm so glad. So that's one thing. And then the other thing I would say, and I'm saying this to myself, but I'm also saying it to all the people that I've coached and all the places it's come up and all the imposter syndrome participants, is you're enough. And I think that this returns often enough in my professional world for me to see that this is a basic human wound. I don't think I'm particularly weird. I mean, I might be weird, but I don't think I'm particularly weird in thinking this. I think it's really normal to really question whether you're okay or not, whether you're good enough at work, whether what you're doing is right or wrong. And I think that's magnified as a younger person when you're also trying to find your way and make a robust choice that works for you and all the rest of it. So I would say, just keep going and know that you're enough and follow your instincts, because I've had a pretty non-linear career path and I've enjoyed it. So that's been great.
Thank you. I think they're really, really lovely notes to finish on, that you are enough. Please continue what you're doing. Make sure these schemes continue. Share, be a leading light in coaching for doctors in the Leadership Fellowship scheme, because we've got some fantastic people coming out of there, which are how we'll all, you'll be remembered when your job finishes one day. Hopefully not for a while. And thank you personally for the opportunity to train as a coach, and actually the supervision you give me, because you are somebody I just have up there. So I thank you, and thank you for people listening. If you're interested in scheme review in Yorkshire, have a look. If you want to be a coach, contact. If you want to have a coaching scheme, think really carefully of all those different layers. It's not just about putting the training in. You've got to build the whole scaffolding is the word I think we used in the infrastructure. So thank you, and we'll catch up with you soon. Take care.
Pleasure. Thanks.